All right, guys, let's start back with anemia. Again, we're in chapter 40. Um, anemia is anemia is a clinical indicator, not a disease. Okay, so remember that anemia is a clinical indicator, not a disease. Common causes of anemia are iron deficiency anemia is the most common worldwide. All right, refer to table 40-1 on page 814 to look at the different types of anemias. Um, as far as we're concerned for this class, I want you to look at iron deficiency anemia because it is the most common worldwide. So it's an inadequate iron intake caused by either iron deficient diet, can be from alcoholism, can be because of a partial gastrectomy. They can have malabsorption syndromes. Um, it can also happen during pregnancy, adolescence, and infection. So I want you to make sure you look at those. It's the fourth one down. It's iron deficiency anemia and common causes. I with iron deficiency anemia, it is seen more in women, older adults, and people with poor diets. It can be from blood loss or poor GI absorption of iron or inadequate iron intake. Okay? Make sure you take some time with the key features box, chart 40-3, again on page 814. It looks at the integumentary system that we all know what anemic patients look like. They're pale, especially their ears. Their nail beds will be pale. They will be cool to the touch. They will always be cold, even if it's not cold. Their nails will be brittle. Remember where to look for pallor in our African American patients. You look for it in their mucosa or in the palms of their hands. Make sure that you're aware of the cardiovascular signs and symptoms. Remember, they can have tachycardia. You can hear murmurs and gallops sometimes with anemias, and you will have orthostatic hypotension. Always make sure that you have assistance when you're getting someone up who is anemic. That's a safety thing, isn't it? For respiratory, remember they're going to have dyspnea on exertion, and they're going to just be more tired than usual. A lot of times, patients who've had a hemorrhage and are recovering from it will talk about how they're just exhausted all the time. They may, if the anemia is bad enough, actually have decreased oxygen saturation. Because if you think about it, what carries our oxygen? Our hemoglobin. Our hemoglobin is part of our red blood cells. So if we ain't got enough red blood cells, we ain't got enough oxygen. All right? Alrighty then. Again, we already talked about how they'll be somnolent and fatigued. They may even complain of headaches. Now, the considerations for older adults is in the green box on page 815. You know how I like my JEROs. So make sure that your older adults, they may often have a restrictive diet and are unable to eat meat, maybe due to the fact that they're edentulous, or the fact it could be economic reasons also. You also want to look for family history of B12 deficiencies can occur in patients between 50 and 80 and may have an inherited gene mutation as well. Okay. A lot of times with your elderly, they can be very vague and the disorder can be easily overlooked. Alrighty. That's the things with our older adults. So that's anemia in the nutshell. All right, now we're looking at leukemia. The cause is unknown. All right, most often occurs in stem cells causing excessive growth of a specific immature leukocyte. Cancer loss of normal cellular regulation leading to uncontrolled production of immature white blood cells. Okay, so bone marrow becomes overcrowded with these immature, non-functioning cells, and the production of normal cells is decreased. Now, hear me out. In acute leukemia, the changes are more rapid And without intervention, these patients will have a death from infection or from hemorrhage. In chronic leukemia, the cancerous cells may become more mature. All right. I will not test you on the classifications by cell type of the anemias in table 40-2. Again, I promise you, beyond a shadow of doubt, I will not put a test question on that. I do just want you to, just take a quick look at it and see where the different leukemia classes are. Okay. I will, though, on the other hand, test you on chart 40-5, looking at key features of acute leukemia. We look at how they can have the petechiae. They will sometimes have open infected lesions. They'll have their conjunctiva will become very pale, as well as their nail beds. They'll a lot of times will have bleeding gums and anorexia. They'll have some hematuria. You'll see bone pain and joint swelling. Again, you'll see some tachycardia, some hypotension. Again, these people have shortness of breath on exertion. They're usually fatigued. They usually will have headaches. So these are things that are key features of acute leukemia. So do look at those. So now we're going to look at assessment of the patient with leukemia. We're going to look at the platelet function is decreased, that this interferes with clotting. A lot of times these patients will bleed out is how they end up dying, especially those with acute leukemia. They'll have weakness and fatigue, can also be from anemia. They'll have cardiovascular changes, including increased heart rate and decreased blood pressure. Respiratory rates are sometimes increased. They'll have abnormal breath sounds. A lot of times these patients will get respiratory infections. You'll again see those skin changes we've already talked about with anemia. A lot of times bleeding is a big deal, is a big factor with patients with leukemia. So they'll have rectal bleeding. They may have some constipation with hypoactive bowel sounds. Big things to note, remember that leukemia can be cured, but the acute phase is long and requires an interdisciplinary team approach. Platelet function is decreased. And so because their platelet function is decreased, you want to make sure you're asking them about, do they have frequent nosebleeds? A lot of times women will have horrible menses when they have leukemia and have their menses at the same time. They'll have a lot of bleeding gums. They'll have rectal bleeding. They'll have hematuria. Again, bleeding is a big thing with patients who are in the acute phase of their leukemia. So what are some diagnostic tools? Your usual ones, you're going to see a low H&H, platelets, you're going to look at your white blood cells. You sometimes will have high white blood cells, but remember they're mainly blasts. If they're mainly blasts, it's a poorer prognosis. Remember those blasts are those immature little white blood cells that can't do anything because they're too immature, okay? The clotting times and their clotting factors will be all messed up. A definitive test is that bone marrow biopsy, okay? And it's the examination of the cells from the bone marrow aspiration to see what type of leukemia it is. And sometimes they'll have imaging testing. It's really just depending on the signs and symptoms that they're experiencing. So what interventions are we going to do with leukemia? Infection is a major cause of death in patients with leukemia. They have neutropenia. You have to make sure that you are using really good hand washing. A lot of times they're in different rooms. They're usually in a private room. They're on neutropenic precautions to where, so that people with infections don't come in to see them. Most common sources of these infections can be skin, respiratory, and intestinal. Okay? The patient with leukemia, as we know, is immunosuppressed. The infection is because, remember, those white blood cells, those blasts, are immature and they're non-functioning, and they are being depleted by the chemotherapy. Sometimes their infection is auto-contaminated, meaning it's their normal flora. So that intestinal tract, it could just be the good old-fashioned E. coli that lives in there all the time, starts running amok, okay? Cross-contamination is when it's from an outside source. All right, so keep that in mind that sometimes these patients actually just infect themselves from normal flora that lives in their body. The most common infection is a gram-negative bacteria, okay? On chart 40-6 is a focused assessment looking at patients at risk for infection. And just make sure that you look through that to see where we are with our patients who are more at risk for infection, who have the leukemia. If you read through it, that it's very basic, your normal patients that would be at risk for infection, those kind of assessment things. So what are some nursing interventions with people with leukemia? Infection protection is a major focus of nursing care. Wow, that's bolded and everything. There's a critical rescue box on page 822 talking about elevated temperatures. Remember, these patients can be so, can get infections so easily that an elevation of even 1 degree Fahrenheit above their baseline is significant for a patient who has leukopenia, and indicates an infection until proven otherwise. Okay, so make sure you do take a quick look at that as well. You want to make sure that you are providing frequent pulmonary hygiene, which is the turn, cough, and deep breathe, using an incentive spirometry, all of those things to keep those lungs nice and clear.